Welcome back. In this video we'll learn about optic neuritis. Important topic. Let's concise the notes so that you will remember the content to fill the paper. Write the same dialogue. Okay, let's start. So itis, whenever itis comes, it's an inflammation, right? Neuritis means inflammation of nerve. So here we are talking about eye, so it is obviously optic nerve. Okay, that was a lengthy statement. Still, yeah, we have types. So any idea what are the types? First one, papillitis. So itis, no need to say, I guess. Inflammation of intraocular part of optic nerve. Yeah, there are different part of optic nerve which we study based on their location. Okay, so this is a part of intraocular part. Then we have neuroretinitis, inflammation of neuroretinal ring. Then we have retrobulbar retinitis, where inflammation of retrobulbar part of optic nerve. Okay, I hope there is no confusion with the statement. So make a simple diagram. Okay, this is a retina. This is your optic nerve passing at the optic disc, right? So I'm just representing how this intraocular part of your optic nerve, intraocular part of optic nerve. That's fine, right? Yeah. Then सर आप तो एक ही डायग्राम बनाया, तीन टाइप्स लिखवाया. Okay, let's draw the other types. Okay. I don't want to show my drawing skills, so I was avoiding. Okay. This is, yeah, guess, this is your retrobulbar type. Then we have another one we have to draw, right? Yeah, take this. This is neuroretinal ring. This is neurocup, or you can call it as cup disc. So this is optic disc. Optic disc means neuroretinal ring plus your cup disc. Okay, so basically what is the neuroretinal ring is like? Transmit out optic nerve fibers. So in the cup to transmit in the retinal vessels. Yeah, that's it. I hope you people got the meaning of this. So we will discuss these three types like very not that detailedly, briefly. So let's take the first one. Papillitis. So I said it is due to viral infection, or even it may be due to immunization. Coming to disc margin, it will be blurred. So if there is blurred, something happening with the disc margin, usually it will be disc edema. Okay, then we have neuroretinitis. Here also disc margin blurred. You got the point. Blurred means edema. Then macular star appearance. Where we'll see this is typically seen in at cat scratch or Bartonella Hensley infection. Remember this cat's scratch disease, where we see this is an important point for MCQs. Okay, then we have retrobulbar part. As usual, but not as usual. Every time it won't go same with this disc margin. They are describing something in this medical sciences topics. If they are taking some topic normal or abnormal continuously, and there should be some exception, right? So we have retrobulbar neuritis, we have normal disc margin. Yeah, very important. Okay, so we will see multiple sclerosis. So we studied about the types, then we'll come to the clinical features. Generally, pain. How pain will be? Dull in nature. Plus you will ask ocular movement, right? Movements will be usually not restricted. Pain will be seen when there will be ocular movements. How the pain will be? Dull in nature. Loss of vision. How it will be? Sudden, progressive, painful. Yeah, it's like 3 years at the end posting, you'll usually find this like painful loss of vision, painless loss of vision. Don't forget to revise and go. Okay, topics are important for your end postings. Color vision affected. We'll talk this topic deeply in the retina topic. Just remember this dyschromatopsia. Sin. Okay, then afferent pupillary defect. Yeah, RAPD. We have a short video about this RAPD topic. We discussed a bit briefly. You can watch that video for detailed section. Then what we have? Palfrich phenomenon. This will sense depth perception of a moving object. Then we have one more symptom, increased symptoms of optic neuritis on excessive exercise or exposure to heat. What we call this as important point, Ophthalm's symptom. Ophthalm's symptom. So we have two named symptom, not symptom, related topic to this clinical feature. Palfrich phenomena, Ontoff's symptom. So we diagnosed, we know the clinical features, and at last we have to treat. So treatment, we give IV steroids. So preferably methylpred 1 gram stat dose for 3 days. Stat, second year, so those who are watching for those end postings, stat means at that point we give 1 dose of the preferred dosage. Okay, then we give oral methylprednisolone 1 mg per kg for 11 days, or it may be for 14 days, depends on the prescriber, right? Yeah. Then what else? Yeah, let's revise it quickly. It's a big topic, very important topic. You need to revise before going to your board exams or for the entrance exam. Optic neuritis, inflammation of optic nerve. Types we know: papillitis, neuroretinitis, retrobulbar retinitis. We saw the diagrams. Papillitis, mainly viral infection, blood, disc edema will be present in neuroretinitis type, and papillitis, which is normal on retrobulbar type. So this is seen in multiple sclerosis. Okay, then cat scratch disease, don't forget, neuroretinitis. Then clinical features, we saw pain, dull on ocular movements, loss of vision which is sudden, progressive, painful, color vision will be affected, dyschromatopsin. Then apparent pupillary defect, RAPD, watch out my that video, RAPD video. Then Palrich phenomena we see, so sense of depth of moving object will be seen, increase symptoms of optic neuritis on excessive exercise or exposure to heat, we call it as on of symptom. Then what is the treatment? Steroids, start dose methylpred we will give for 3 days, then we'll continue on the oral methylpred 1 mg per kg for 11 days or 14 days. Yeah, that's it. I hope you people learned this topic very well. I tried to concise the topic under proper headings. So that's it. Don't forget to, as usual, the same thing what YouTubers want, subscribe. Yeah, have a great day, enjoy the videos, bye.